This is Boomer Life on CL 650.
George Gordon back with you on CL 650 Boomer Life. We're talking to naturopathic physicians Dr. Eric Posen and Dr. Larry Chan from the Integrative Naturopathic Medical Center here in Vancouver. And we were talking in our last segment about the medicines that we take that we think that are combating conditions. And diabetes is of course, one of the most common and chronic problems, and is taking over a society that can't seem to keep its face out of the sugar bowl in one form or another. Larry, you wanted to address some of the things that we should understand about this.
Yeah, type 2 diabetes actually in North America and Western society is actually approaching epidemic proportions at this point. And young people are getting type 2 diabetes as well as we speak, and more numbers are happening there. Probably due to diet, probably due to environment, toxicity in the body. But really, when you mentioned the medications you're taking for it, it's interesting because when people are going on insulin, and you can take medication for type 2 diabetes, but some people actually progress to insulin use because they can't control it with their diet or mild exercise or metformin or glycovite. But what you can do is when you have insulin, you start with 12 units a day. Eventually, you work up to a year's time, you may be needing 20 units a day, and then you go to 40 units a day. But your blood sugar stays the same and stays healthy. It looks pretty good. You're actually getting worse because you're needing more medication, right? Because the body is actually fatiguing and the oxygen utilization is breaking down over time. Because you're actually not fixing the problem. You're just stalling and kind of making it, putting an unhappy face on the problem by giving insulin at this point in time. But anyways, beyond that, when you mentioned taking blood pressure medication for diabetic, cholesterol medication, and also taking blood sugar medication, that's actually falls right into healthy aging or an anti-aging medicine. Because actually, if you look at as our bodies age, after men and women after menopause and andropause, which means that your testosterone's really dropped off, at around 60 years old, I think our hormone levels of testosterone for men, DHEA, growth hormone, those are key hormones, they've crashed. They're 70% down. You're running around 20 to 30% capacity. That's when you're 30 years old. If a person comes in and you measure their testosterone levels and they're all down, if you give that person on those medications, testosterone, and they're doing the right things, you'll see those numbers get way better. And it's amazing the hormone component for keeping a person healthy and less biologically aged based upon hormone therapies is tremendously supportive of diabetes as well.
Well, I would think you would catch the attention of a lot of boomers when you start talking about the possibility of making a difference and not taking those medicines and actually feeling better. Have you had case examples? Like, talk to me about somebody, say, my age-ish, coming in with that. Have you been able to get them off of these medicines?
Absolutely. You can see that change quite dramatically for many people. You can see their weight reduction getting much better, their vitality picking up, and you can get them off those medications dramatically, or else reduce them dramatically. And balancing the hormone systems.
And I would think to the healthcare system that would reduce some costs.
Mm-hmm. I mean, another critical part to what Larry was talking about is that a lot of people who do everything right in terms of following diet, if they've been given a diabetic diagnosis, working with exercise, taking medication to support themselves, and they still can't lose weight. What's the problem? Well, one of the most common problems has to do with a low-grade thyroid problem that's still underlying the whole thing.
Okay.
Because the thyroid is critical for helping the body burn fats for energy. So, and this ends up going into a large discussion on what thyroid function is. Your thyroid is responsible for your metabolic rate, which basically is how well you can burn nutrients for energy production and fat metabolism. And when we evaluate classically thyroid function, you go and get a blood test. And there is a test called TSH, or thyroid stimulating hormone, which is a hormone put out by your pituitary gland in response to active thyroid levels in the blood. And if the thyroid levels are low, the pituitary is going to say, kick it up. So it's going to make the TSH level rise. So when you have a TSH level that goes beyond, I think most of the ranges in BC labs, I think the upper range is what, 5.4? Is that what
5.5.
5.5, yeah. So if it's up in that upper area, 5.5, 5.6, then they're going to say, you have a low thyroid problem, and then you'll be given thyroid medication. Unfortunately, it's a broad range they use, from 0.7 to 5.5. And optimum is 1. So you could be feeling pretty crummy, low energy in the morning, feeling cold, a lot of stiffness in your upper body and your shoulders, chronic weight gain, and you're coming into the doctor's office, you do a TSH, and it's 3.4, 3.5.
Be normal.
And
That's
would be
normal.
Under
And therefore
that
you don't get treated.
definition.
Wow.
So you'd have to really look further to that. Here's all the clinical signs of a low thyroid function, but you're going to call it subclinical, and is it worth treating? And if you looked at evidence-based medicine, which is what standard medical care is all about, they'd be saying, no, if it goes beyond a certain point, then you start giving a thyroid hormone. But in our office, we might consider that differently and start treating the thyroid at an earlier point. And you can treat the thyroid through, sometimes people are responsive to medicines that are the metabolic building points for thyroid hormone, as opposed to the actual hormone itself.
I think that we also see tremendous, we see this on a daily level.
Yeah.
We see patients coming in that are on medications for depression, that are medications for all kinds of, or their immune system is compromised, and it's their thyroid. And we actually boost their thyroid, and changes are dramatic, and they happen quickly.
So a middle-aged woman who most recently, I've seen her for years, but she got diagnosed with a thyroid problem, as a low thyroid, a hypothyroid function, and it had gone beyond that range, and was being given Synthroid, which is a combination of T3, T4, which are some of the hormones involved with thyroid function. And what she was finding is exactly what we were just talking about with the diabetic medication, is that you start at the Synthroid at this level, and then after a few months starts feeling tired again. It was good for a bit, and then she got tired again, and the TSH was rising. So let's give more of the T3,
right.
T4, of that substance. And you end up pushing it at that level, but you're not finding, well, why is the thyroid crashing time and time again, as opposed to just supporting it with more and more medication. So that then became, when she came to see me, we ended up going through a wide number of things that we do in the clinic, and she had a chronic viral infection that she had been fighting for about 10 years, and that her body was still on a daily basis trying to resolve that. So we use therapies to support her immune system, not as an, you're not going to, when you're dealing with a chronic viral infection, there's no medicine that's going to target the virus and knock it out. That just doesn't exist. What you can only do is help and enhance your body's ability to fight an infection. So then you have to evaluate your adrenal function. You have to evaluate your entire hormonal system, as Larry's talking about, and you have to evaluate your body's ability to utilize oxygen.
Well, as a layman, and perhaps somebody involved in this discussion from the diabetic point, it sounds like everything you've told me is pretty common knowledge. Mm-hmm. I mean, it's basic chemistries and understanding what's happening in the body. Why are we not having more discussions in the allopathic side of medicine about, something other than what we've been treating diabetes with, type 2 diabetes, for example? I don't hear a lot of that.
I think the main reason is the evidence-based part of it is always about, they're looking for value changes, like a range of changes in the values when they do a blood test or any kind of hormonal test. If you meet the criteria of that test, i.e. your blood sugar levels or A1C in diabetes, Or in thyroid, you're meeting that TSH criteria in terms of range. If you're in the range, don't worry about anything else. They're not putting the other pieces together. And if you're low in the range, they'll bump up more medication, like Eric said. You just keep bumping it up until you stay in that range. What we want to do is look bigger picture. Always about bigger picture. So even in our healthy aging program, in our clinic anti-aging program, the testing is really broad spectrum. You're looking at hormones, you're looking at toxicities, you're looking at is there heavy metal poisoning in the body, is there other organ faults that are not doing well? What's your oxidative potential? Are you utilizing oxygen properly? Those are all important elements to determine what we can do for the individual to keep them optimally vital and healthy and to age healthy.
Yeah, we haven't even talked about sleep, but that's the whole
Sleep, what's that?
Exactly. Remember what that used to be.
That's right. Where you actually woke up and you felt rested. What a concept. Look, let's talk. I don't want to lose sight of some of the treatments that you do offer at the center when we're talking about blood and tissue oxygenation. What about hyperbaric oxygen therapy? Tell me a bit about that.
Well, we don't do hyperbaric at our office.
Okay.
We refer out for that, though.
We refer out to it. And
is that done here in BC, though?
It is, yeah.
Okay.
There are people who are certified in it. There are naturopathic physicians who are certified in it. It's standard practice for some, I think there's hyperbaric in some of the hospitals.
Yeah, for burn usually, burn victims.
Right,
Usually.
and burn victims. And also for after head injuries. It's a very useful therapy. What we do in our office, which is, since we didn't have the hyperbaric chamber, is we use ozone. And ozone it's very simple. I mean, it's been around for a long time. It's basically oxygen. So we use medical grade oxygen. And if you expose oxygen in that form to either an electrical spark or ultraviolet light, it splits the oxygen, the O2 atom, and you end up with O3. So you have three molecules. And this is a very unstable molecule. It's got a half-life of maybe about half an hour or so. You can smell ozone.
Right.
You've probably experienced that sort of clinically clean smell.
Yeah.
But it has a profoundly powerful effect in the body, because once it gets into your body, and primarily if it gets into your blood, it immediately turns into oxygen. Immediately. So you think, well, what's the point of putting ozone in? Because now we can't measure ozone. Well, basically, there's no receptors in our body that biologically use ozone. They're all oxygen receptors. But the key effects of ozone therapy is that once it gets into the blood, it stimulates a wide number of cascading events within your red blood cells and in the mitochondria that enhance your immune system, that help tissue repair, that at its most bottommost line help your body utilize oxygen. And it's how we get that into your body. There's lots of different ways. You can use it as a cream on skin for, like, say, dermatitis or some allergy reactions. It's held into like an olive oil solution, so that keeps it bound and active. We can do it rectally. This is the part where most of my patients go, whoa, I'm not sure about that. But it's a very simple process. And it's to the point where you can self-administer it. And it's you put the ozone in, you hold on to it for a couple of minutes, and that's it. But what it does, it has a direct relationship to your blood supply and to your liver. So its effect on liver detoxification and liver health and gut problems, colitis, ulcerative colitis, all those errand complaints that most of us in our middle ages might accrue to, that's a part of it. And another way that is very powerful is using something called major autohemotherapy, where we draw your blood out in a closed system, and there's no external exposure of the blood to anyone, and then you infuse that blood with the ozone gas, external to the body. You mix it, and then you have this highly oxygenated blood, which you can see. It immediately goes from a dark red to bright red because of the oxygen content, and then that gets reinfused back into someone's body. And that has an effect throughout your entire system, along the ways of what we're just talking about.
And is this a complicated procedure? You do it in.
It's easy. We do it in our office. It takes about an hour for a sit, and it's very comfortable and it's very safe, and there's no reported toxic effects from it. So the use of ozone therapy is a very safe therapy, and it's used for many things, right? We treat anything that requires oxygen, so you can enhance cell regeneration. It can retard aging cells, so keep you younger and healthier. People use ozone for injection right into joints to help the joints, pain in joints and arthritis and things like that as well. In fact, there's a lot more research coming out now in terms of clinical application of ozone directly injected into discs to help discs in the back as well. Getting some great results with that. And it's great for things like concussive injuries, cognition, dementia. These are some early signs that it's helping Parkinson's and also MS and different kinds of autoimmune diseases as well. So wide application because it goes back to the common denominator. How is one thing so good? It's like a panacea. Well, it is a panacea because all our systems depend on oxygen utilization. The exciting thing is that we can help provide that to the individual safely at a very competitive price. What point is not expensive therapy at all, very easy to administer, and the results are very dramatic and widespread.
I mean, it does take a commitment too. I mean, when you're going to do something like major auto chemotherapy, you are going to be spending anywhere from once to 5 times a week doing something like that for a period of time, because it takes that long to start to change cellular tissue around. And the whole point, as Larry said, is it's not a panacea because ozone isn't a key drug. It's not the magic bullet. What it does is it enhances your body's ability to self-regulate and do these things on its own. So it becomes part of many other therapies that are also necessary to help your body utilize oxygen.
All right, I want to talk a little bit more about this, and we'll come right back. And it's aging wellness. It's the new thinking. You know, everybody talks about the 60 being the new 40. Well, what happens when the 20 is the new 60? Because you're not doing when you're some things that you're not doing correctly. And we're talking to the people who can help you get back on track. Dr. Eric Posen and Dr. Larry Chan. They're naturopathic physicians with the Integrative Naturopathic Medical Center. We'll talk again a little bit about where you can learn more about this on integrative.ca and how you can get in touch with the clinic and perhaps get yourself on a really much smoother road to wellness. This is Boomer Life on CL 650.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.